Hello everyone, I'm Farzana Afroz. I'm the Residency Program Director at Albany Medical Center. I am an Associate Professor of Anesthesiology and I specialize in pediatric anesthesia. I have had the joy and privilege of serving as a Program Director since 2023, and it has been truly a humbling and rewarding experience for me for the past 2 years. This presentation is to give you a brief overview of our program and also to point out why training at Albany Medical Center would be a unique and enriching experience for you. I am going to give you as brief an overview as possible of what our program is all about, our hospital, our department, and the people who make it work. This picture is from our Albany Medical College graduation, which is held every year at the Saratoga Performing Arts Center. SPAC is consistently ranked as one of the top outdoor venues in the U.S., hosting world-class performances in ballet, orchestra, and symphony, as well as major concerts. It's just one example of the rich cultural opportunities available in this region alongside everything else Albany has to offer. Our medical college was founded in 1839 and the hospital was founded in 1849, but neither of those two original buildings still stand. The current medical center now is a combined long building located in a slightly different location. In 2011, we acquired South Clinical Campus, which is a small hospital located about 2 blocks away with 8 operating rooms. This is where we do our ambulatory surgeries. In your CA3 year, you do 1 month rotation there for ambulatory center experience. Our institution has been lucky enough to be growing. Over the years, we have incorporated into Albany Med Health System. And under this system, we have Columbia Memorial Health, which is about an hour and a half south from us, Glens Falls Hospital, which is about an hour to our north, and Saratoga Hospital, which is half an hour to our north. Currently, we do not have any of our residents rotating to any of these locations. However, possibly in the future down the road, there is a possibility of that if we feel that it would be advantageous to the program. In this aerial shot, you get the view of the whole campus of the Albany Medical Center. You can see the college on top of the picture, and to the right, you can see the Masuri Family Children's Emergency Room, and as well as adult emergency room down below that. And slightly to the left is a patient pavilion, and some of the windows that you see are outside of the operating rooms. And yes, we are lucky to see some daylight, which can be very helpful to our wellness during the winter season. In addition, you can see several flyovers over the streets, which provides easy access to the parking garage from the main hospital and gives us the ability to get over to Panera and also Starbucks without having to step foot outside, which is very helpful during winter times. Albany Med has become part of a bigger health system that includes 4 hospitals that I mentioned earlier, a children's hospital within the hospital here, and of course we have a medical college and a visiting nurses association. As you can see, we have a large number of employees, over 16,000 employees. We have about 125 locations, including all of our urgent meds and physician offices. We have 800 plus physicians and 60 plus specialty areas. So we are really the coordinary referral center for the entire 26 counties. So our facility has 766 beds. We have a children's hospital within our hospital. We do various type of cardiac surgeries, including pediatric congenital open heart surgeries. All surgical specialties are represented. We have a very busy high-risk OB, and believe it or not, we have the busiest trauma center, level 1 trauma center in New York State. In 2013, we moved into new operating rooms and ICU tower. 20 new ORs were built in brand new B building and 15 new ORs were built in C building. Total of 35 operating rooms that's running in a given day. In addition to that, brand new PACUs were built in both locations, and 2 new ICUs, a surgical ICU and a neonatal ICU, was built at the same time. In this picture, you can see what our ORs look like. They all include a standard anesthesia machine. So once you learn one machine, that's all you need to know for all the other operating rooms. An anesthesia cart, which is standardized throughout the institution. So wherever you go to provide anesthesia, you'll find everything exactly at the same location. And an Pyxis machine in every operating room, which makes it incredibly convenient for you to remove a wide area of medications, including controlled substances, narcotics, and other necessary drugs that you need to provide a safe anesthetic. And it allows you to waste any unused drugs with the licensed provider at will. This is an example of our PACUs, more specifically our pediatric PACU, which you can tell by the fish on the floor and floating up in the ceiling as well. At the bedside of each pediatric bay, there is a rocking chair for the parents of the patients so that they can get comfortable while they are waiting for their child to wake up. Albany Medical Center serves as the major referral hub for a wide region, approximately 26 counties across upstate New York. Orange counties represent our nearby catchment area, where patients often come for routine or simpler procedures. Green counties represent our tertiary referral area. These regions have smaller hospitals that may not have all surgical subspecialties available, so patients travel to Albany Med for advanced or complex care. Our reach extends beyond New York State as well. Patients frequently come to us from Bennington County in Vermont, Berkshire County in Massachusetts, and even part of Pennsylvania for specialized services. The broad catchment area highlights Albany Med's role as the region's leading tertiary and quaternary care center, ensuring that patients across multiple states have access to full spectrum of surgical and anesthetic care. We are a strong and collaborative department that includes approximately 50 attending anesthesiologists and 28 residents, with 8 residents per year since expanding the class size in 2023. Our team also includes about 50 CRNAs, many of who are part-time and who are truly wonderful colleagues to all of us. We have a student nurse anesthesia program with 25 students annually. They rotate through several clinical sites, so any given day 5 to 8 students are present at our main campus. This program also serves as an important pipeline for future CRNA workforce, as many of the graduates choose to remain with us. Our perioperative care is strengthened by a dedicated team of perfusionists and a wonderful group of anesthesia techs who streamline room turnover and ensure that specialized equipments are ready, allowing us to remain focused on clinical care and patient safety. Finally, none of this would be possible without our exceptional administrative and billing staff who ensure accurate, timely documentation and operational efficiency. Together, this multidisciplinary team forms the backbone of our department, creating an environment where education, patient care, and teamwork thrive. Your clinical base year is very unique and is thoughtfully designed to complement your future training in anesthesiology with us. It provides a strong foundation in internal medicine, pediatrics, emergency medicine, and perioperative care while giving you early exposure to anesthesia-related skills. You do 5 months of medicine, which includes 1.5 months of night float, some at the VA hospital across the street, but primarily at Albany Med. During these rotations, you get exposure to inpatient care and complex medical management. You also do 1 month of medical ICU and 1 month of coronary care unit. You do 1 month of pediatric inpatient subspecialty, typically hem-onc, with excellent teaching and caring for complex pediatric patients. You also do 1 month of pediatric ICU. Albany Med is the only PICU for 26 surrounding counties, so interns gain extensive exposure, including post-operative congenital heart patients and diverse critical conditions. You do 1 month of emergency medicine. You get 1 week of elective when the residents do echo course in our department. You have 1 week of system-based practice week and QI together, which includes engaging lecture series plus development of your first QI or research project, which you continue to develop and work on throughout the year. 2 weeks of perioperative assessment clinic, evaluating patients, counseling, and learning perioperative risk management. You get 8 to 10 weeks of enhanced recovery after surgery, also known as ERAS rotation, a highly popular rotation where you closely work with nurse practitioners on daily rounding, pre-oping patient prior to surgery, counseling them, and setting up expectations after their surgery. You get exposure to multimodal pain management strategies. You learn ultrasound skills. Many interns complete 50 to 100 abdominal wall or TAP blocks before entering their CA 1 year. And finally, you get 1 month of vacation. During your clinical base year, we highly recommend that if you can to attend the monthly afternoon lecture series, which is offered every Monday to our CA1s at 3 p.m. These lectures are aimed at passing basic exams. All residents get early access to Anesthesia Toolbox, which they can use as study guide throughout their training. We encourage you to attend the monthly journal club when you are able to, and quarterly NYSSA District 4 dinner meetings, which are held at the local restaurants. NYSSA stands for New York State Society of Anesthesiologists. In addition, we hope to foster a collaborative early relationship with you through your interaction with us during your ERAS rotation, pre-op rotations, or research, QI, and pain and active rotations that you might take with us. And here is a slide of our happy residents having lecture at the lecture hall. During your CA 1 year, you get 2 months of introductory course, also known as bootcamp, which starts in June. Once you get through the introductory course, for the rest of the CA 1 year, you do 4 months of general OR doing various types of general cases, but many days you will end up doing complex cases as we do have a lot of sick patients coming for elective surgeries. Patients may be coming for simple procedures like lap chole, but may have underlying hypertrophic cardiomyopathy and various other heart conditions, so you will be challenged in those 4 months. You start subspecialty rotations as early as September, and it's planned this way because we understand it's important to get exposure to subspecialties early so you have an idea if you are interested in fellowship, as you need to apply for fellowship in your CA2 year. You will do the following subspecialty rotations. You do advanced airway, cardiac, CQ, OB, neuroanesthesia, pediatric anesthesia, and a combined regional chronic pain rotation. And each rotation is 1 month long. And this is an example of our master schedule for the residents. Here is a quick review of the ABA's staged examination system. We have multiple attendings in our department who are ABA board examiners, including Dr. Ellers, our former PD and current interim chair, who is a senior board examiner, and Dr. Parikh is another one. Having multiple oral board examiners is a huge advantage for the residents in terms of getting updated information about any change in the applied exam, and residents can take advantage of them practicing oral board sessions with them. Basic exam is one of the first high-stake exams that you will take at the end of the CA 1 year. It is a must-pass exam for you to advance further and eventually graduate. As the name implies, it tests you on basic topics like pharmacology, basic physiology, anatomy, anesthesia equipment, and basic monitoring, versus the advanced exam focuses more on subspecialty types of topics. The basic exam was first implemented in 2014. Our Monday afternoon didactic sessions are specifically designed to prepare you for this exam at the end of your CA1 year in June. This is a picture of one of our lecturers giving lecture to the CA1s. We do combinations of active learning with lectures and flipped classroom models with PBLDs and preparing keywords by the residents as well. This is a sample of how our didactic schedule runs for all the residents. We start with general anesthesia topics, segue to cardiac, followed by ICU and regional. We do questions and ITE review right before the ITE exam in February. Then we move to OB, pediatrics, PACU, neuro, thoracic, and lastly, chronic pain. This way we cover all the specialties that we need to cover. Our residents do monthly simulations, and some are multidisciplinary fashion with general surgery, OB, and ENT. Starting from this academic year, we have implemented separate didactic sessions for the CA3s to prepare them for the advanced exam, which will be held twice per month on Tuesday afternoon. These sessions will be a combination of keywords and oral board practice. And this is the auditorium that we use for grand rounds and monthly M&Ms. We have a weekly grand round which takes place every Thursday morning from 7 to 8 a.m. This is a protected time when the ORs are not running. Typically, first Thursday is the business meeting. The residents would meet the chiefs in the resident lounge separately. It is an opportunity to discuss issues, and any problems that you foresee need to be brought back to me and can be brought back to me by the chiefs. One of the weeks would be M&M presentation by the residents, and the other 2 weeks we would have guest speakers from inside or outside of our institution to talk about various diverse topics. Our CA3 residents also present a grand round for the department. Journal club is held on a monthly basis. We do a dissection of the statistical methods used, since there is a fair number of questions on statistics on the basic, IT, and advanced exam. Dr. Silverman, who is the director of our regional anesthesia, is wonderful at delving into the information, and 2 of our residents will take turns on critical review of the literature. During your CA2 year, you move into slightly more difficult rotations. You have 1 month of PACU, echo, and trauma, also known as PET rotation. And during this month, you will be able to practice more focused transthoracic echo. Another repeat of neuro, cardiac, CQ, peds, OB, and regional. In addition, you have 2 months of thoracic, 1 month of vascular, and 1 month of chronic pain, and 1 month of elective. This is the master schedule again, showing those rotations. Here is a quick look at the case log from one of our former residents. The number in blue is the minimum number required to graduate, and number in red is total number the resident had. As you can see, this resident is well above their required number to graduate. In this slide, you can see the total peripheral nerve block numbers in the 400 range. Most of our residents graduate with 300 to 400 range. So you will be very comfortable performing peripheral nerve blocks. I want to briefly mention the global outreach opportunities that we have in our department. Our residents have had the opportunities to participate in various mission trips in various countries. As a CA3 resident, they have been to Zambia, Nigeria, Guatemala, Madagascar, and Bangladesh.
Just a brief word right here on what we think are our new and exciting things coming up for 2023 and beyond. We continue to expand our use of focused transthoracic echo. Dr. Nibers Bergrara, who is a critical care anesthesiologist, is a very firm believer that we all should be wearing a ultrasound probe, personal ultrasound probe around our necks instead of a stethoscope. So we are endeavoring to keep on pushing this into all areas of anesthesia. We have a very robust perioperative surgical home, which we also call enhanced recovery after surgery, or ERAS here. So we have many surgical services that are clamoring to be part of this as well. We continue with the very successful systems-based practice week, and then followed by a research week and holiday. We do this starting in the middle of December. This enables us to get you out of call rotations during intern year around the holidays, and is probably your last opportunity to take off that week of between Christmas and New Year's. At least during residency. So we are very happy to be able to provide that. And then we're always looking to further our development of our wellness curriculum based on input from the residents, continue and expand upon our oral board review sessions. And we have also integrated some research or wellness, either mornings and or they may be full days. And we actually give you 2 full days of wellness that you can pick during each year of residency.
Our Clinical Competency Committee, or the Triple C, meets on a quarterly basis. The purpose is to review your rotation evaluations and make sure that we are giving you constructive feedback. If there are any issues that we see with your future competencies, we give you that feedback immediately to help create an individualized improvement plan. This is a picture of our beautiful state-of-the-art simulation center. In this picture, you can see from the observation room through the glass pane is an OR that is set up for our mock OR. As I have mentioned before, our residents do monthly simulations at least once per month, sometimes more, focusing on crisis management and teamwork. There is a TEE simulator in the simulation area as well. As we wrap up, I want to shift gears and highlight the practical details, the nuts and bolts, that will give you a true sense of what life is like in our program. This slide shows the current house staff salaries here at Albany Med. We are pleased to be able to provide a competitive salary structure that supports our residents during their training. Our overnight call team consists of 2 attending anesthesiologists and 4 resident CRNA combination for the OR. We have a busy OB service, and for that we have a separate team, either a CRNA or resident. 1 late resident till 8 p.m. and various late shift CRNAs till 7 p.m. and 9 p.m. Backup attendings from home for cardiac and pediatric emergencies. Average work hours for our residents are about 50 to 55 hours, which is not bad at all. On average, they take about 4 to 5 calls per month and 1 to 2 late shifts till 8 p.m. And after a 24-hour call, the next day is off. As far as leave and conference time, the ABA mandates that you get only 20 days per year, which is 4 weeks off. Additionally, you get 5 conference days. Discretionary money is on a graded basis. However, I would say we tend to pool that fund. In that way, we can maximize the use of that fund for all the residents. The department pays for 1 poster presentation at a conference per year, and subsequent poster presentations will be paid if it's an original research presentation. Resident contract can be found at this URL. Everybody, of course, gets a criminal background checks and a drug test at initial hire. And after that, it's only for a cause. So what do our residents do after graduation? While many join our faculty practice, about 1/3 of our faculty members, including myself, are our own graduates. Every year, about half would join the private practice across the country. We have a very friendly fellowship program. Every year, about 2 to 5 residents would go for fellowships in reputable institutions across the country. And we haven't had any issues finding spots for them either. At AMC, we have pain fellowship, which is under neurology, and we do have adult cardiac fellowship, which takes 1 fellow per year. In the past 15 years, our ABA board certification rate has been about 95%. Many of our graduates are in leadership positions in Albany Med and also locally in other private practice groups in the area. We never had any issues with accreditation with ACGME. Our last site visit was July 2011. Only about a quarter of programs get 5 years, which is the maximum amount of accreditation that you can get. And we got that for past 4 site visits that we have had. Now we are accredited annually, and currently we have a clean letter, meaning they don't see any issues with our program that needs to be addressed. The usual cycle for a site visit usually happens every 10 years, and we are waiting for that to happen. Now, let's talk about location. This is a map of New York State, and as you can see, Albany is very centrally located. New York City is about 3 hours drive, and you can take Amtrak and by Amtrak, it's actually a little faster. It takes about 2.5 hours. Boston is 3 hours away, and Montreal is only 3.5 hours away from Albany. Within a 3 to 4 hours drive, you can access many other destinations for a day trips or weekend getaways. Beyond all that, Albany itself has a lot to offer. You will enjoy easy access to culture, food, and outdoor activities. If you like outdoor activities, lots of great places to hike, water skiing, and skiing in this area. Here is one of our attendings hiking Adirondack Peaks, and it's absolutely beautiful. And this is a winter view from a mountain peak. Dr. Green is one of our faculty members who finished all the winter 46 peaks in the Adirondack area. Here is a beautiful lake view of Saratoga Lake where Dr. Ellers lives. There is a lot to do: swimming, jet skiing, water skiing, and boating. Tranquil, scenic picture taken by a resident who took his family for a hike. Here is another picture by the same resident. A stunning sunset view from the Adirondack. So this is the final slide of my presentation, and here are some pictures of our residency recruitment committee members. I'm sorry, not everyone's picture is here. As a reminder, during your interview, you will meet 6 members from this committee, and typically you will have 15 minutes with them. In another way of saying, you will have 15 minutes of speed dating with them. At the end, you will get another opportunity to meet with the program director, which is myself, and also meet with the residents virtually to ask them any remaining questions you might have about the program. Thank you so much for considering our program and especially making it through this long presentation. I'm sorry about it. And lastly, even if you don't come here for your residency training, please consider to join our faculty group in the future. Bye.